Hi everyone, my name's Kristen. I'm one of the clinical educators here at Falmouth. I'm going to be walking you through on how to change a dressing on a PICC line today. Okay, so supplies that we need to bring in. So we want to bring in a central line dressing kit change. We want to bring in our stat lock, and this is for our PICC lines. The PICCs go into the stat lock here. We want to bring in the number of claves that need to be changed, some flushes. And then you can also, there's sterile gloves within the dressing change kit, but you can also bring in your own size. It's completely up to you. So everything, all the supplies are at the bedside, and now we can start by taking down the dressing. So we're always gonna start closest to the patient's head in this direction. And again, we want to be changing any central line dressing every 7 days, and more frequently if you see that the sides are kind of sticking up like this, if the dressing looks saturated, if there is some gauze under the dressing, we want to be changing those every 48 hours. But we're going to start by picking this end up. Coming up with the dressing. That's good, and that's why we want the bio patch with the slit facing this way, so it comes right up. I always like to take the bottom end off, and that way it kind of will just slide right off here without his skin sliding off. So here we have the old dressing, and we can go ahead and dispose of that. And at this time we can pop open the stat lock. We do that just by opening up one, I kind of call them wings, one wing at a time. And we're gonna go ahead and pick this up and gently peel back the stat lock. And that's that. We can go ahead and dispose of this. So at this time, I'm going to dispose of these gloves. I'm going to perform hand hygiene again and go ahead okay, so hand hygiene is done. We're going to go ahead and put our sterile gloves on. And again, there's sterile gloves in the kit, but it's totally up to you whether you want to use those or your size sterile gloves. So now we're going to open our kit here. We can go ahead and drop everything in that we need. Use our sterile drape, and we can drape that right around the arm. What's important with PICC lines is we want to measure not only the actual PICC line itself and how the length that's coming out of the arm, but also the circumference of the arm. And we want to refer to what's charted in the patient's chart. Again, too, we want to look at the insertion site around the PICC line. Is there any redness? Is there any swelling, which is also why we're measuring? Is there any sorts of signs of infection? Any exudate coming out? Anything like that, just checking for signs of infection. Okay. So at this time, now we can start cleaning around the PICC line. So this is our CHG sponge. We're gonna click this in, gonna give it a little shake, and then we can start cleaning around the PICC line. And we wanna do vigorous back and forth motion. At this time too, we can also use gauze to pick up the PICC line and scrub the skin all around underneath. And once the skin is all scrubbed clean, we can also clean the PICC line itself. And again, we're gonna do this for 30 seconds. And we're gonna let this dry for at least 30 seconds. So now it's all dry, we've waited at least 30 seconds. We're gonna go ahead and apply our bio patch. So we can see this is the bio patch. It says this side up. And again, we're gonna have the slit go towards the catheter, towards the PICC line. And we're gonna apply it just like this. And the bio patch is used to help prevent any CLABSI infections. So our skin prep is used when we're using a stat lock device on our PICC line. And we can simply pick up another piece of gauze, pick up the PICC line, and scrub the skin underneath where we're gonna apply that patch, that stat lock. And it's very sticky. So here, we're gonna slide the PICC line into the stat lock. The wings kind of go and connect into where the blue prongs come out. We're gonna snap one side, snap the other, while being sure that we're not pulling at the physical PICC line as well. We're just gonna sides down. Then we're gonna remove the adhesive on this side. And that's down nice and firm. Now we can go ahead and apply our dressing. So this is our clear adhesive dressing. We're going to pull back. The adhesive dressing has these little slits, which is helpful. So we're going to go ahead and kind of line it up with that slit. And we're going to pat it down and get a nice seal. Try to get all the air bubbles out. And then we're going to take this bottom piece here. I'm going to lift this up. We're going to save this. I'm going to pull this piece back. And we're going to lift this up. Apply that to make a nice seal. And again, we're gonna pull this piece off here. And then we can sign, date with our initials and time and date that we performed the dressing change. We're gonna take this off here and put it on the dressing. All right, so now that the PICC line dressing is all changed. So with every dressing change, we're also going to do a clave change. This is 2 claves. So you always want to make sure that the lines are clamped, which they are. And then we're going to go ahead and take our flush, take our clave, we're going to connect it, we're going to prime it, get all the air bubbles out with the saline, and then we can go ahead and remove that clave and change them, and then we're going to unclamp, and then we're going to flush with that push-pause method to create turbulence within the line, so it helps prevent any clotting. And again, we're going to pretend to do that on both lines. And then last, we're going to take our alcohol impregnated caps and put it at the ends, and that way that's just an extra guard against any sorts of infection. We also want to put this along all the ports on IV tubing and things like that. So that is a PICC line dressing change.